back up and running. So I am so grateful for you all joining this evening. We have Dr. Akingbola in the house today. She is the Health Hub with Dr. T's first guest speaker, and it's we're going to speak about the foundation of the Health Hub, which is the sandwich generation. So she's going to we're going to just kind of interact. Please ask questions in the chat. I'm going to try to monitor the comments as we go. If I don't answer, please ask it again so that I can get to it. We're going to start with just a general idea of what the sandwich generation is. We're going to get into some medical things. We're going to get into what that looks like overall. This is a series, so we are going to talk about finances. We're going to talk about caregiver burnout. We're going to talk about so many different things when it comes to sandwich generation. And so we're going to talk about it affecting men's health, women's health, and so forth before diving into a lot more of the specialties. So I just hope that you stay tuned with us as we go through this series. I hope you interact with us, you share your comments, share your experiences in the comments. I want to read them, and also your questions. If we don't get to all questions, we will continue. I will jot these down and try to answer them in a separate live or just on the comment session. So I just thank you so much, Dr. Akingbola, for coming on board. She is all things. She's going to talk about her credentials, what she specializes in. She's going to do a short introduction, and then we'll get started on the sandwich generation. All right, Dr. A, as I like to call you, can you give us a little bit of introduction of, who you are, how long you've been practicing for, and what you specialize in?
All right. Hello, everyone. Thank you again for joining us. It's an honor and privilege to be the first one, so I'm really excited about this series. My name is Dr. Dami Akingbola. I reside in Tulsa, Oklahoma. I am board certified in family medicine, doctor of osteopathic medicine. I graduated at OSU Medical School here in Tulsa. I did my master's prior in OU, and I have been practicing for 7 years. This is my 7th year out of residency, and I practice in a small place outside of Tulsa called Sapulpa, which is a heavily geriatric population. So I do have quite some experience regarding the sandwich generation from both sides, the elderly side and then the caretaker side as well. So thank you for having me.
Awesome. Thank you so much for joining. Being the first is always so we're gonna have to work out the kinks together. So thank you so much. So I want to talk a little bit about the sandwich generation. What is the sandwich generation? What do you when you hear the word sandwich generation, what comes to mind and what has come to you personally and as a healthcare professional?
Are you asking me?
Yes.
Sorry. So to me, the sandwich generation is basically people who take kids, their own children, as well as their parents. Sometimes it can be modified. Sometimes they're taking care of their aunt or their great grandparent. Sometimes you have their grandparents, and they take care of their grandchildren as well as their parent as well. So there's all different aspects of the sandwich generation. Basically, you're taking care of basically 2 generations. You're taking care of mainly your youngers and then your elderly, and then basically trying to juggle that. How do you balance taking care of your kids and older people at the same time? We are in a era where we're living longer.
Yeah.
And we are birthing kids later on in life.
Yes.
So we're in that sandwich generation longer than, ever before. So that's something that we have to navigate as we get older. Mainly, people in their 30s, 40s, 50s. That's what's mainly, part of the sandwich generation, and having to deal with that and what comes with that, emotionally, financially, resources and what's
Yes.
best for you with your family. So
And I'm glad you touched on that because, you said something. I read a study somewhere, or it was on Instagram actually, where they spoke about women are having their kids, more women are having children later on in life than like teen pregnancy, right? So as you said, we are now having children in our 30s and our 40s. Our parents are still here. So it's like, how do we juggle taking my parents to go check their blood pressure because they're having hypertension issues, but at the same time I'm dropping off my kid at daycare? So it's like I'm going from one extreme to the other, and it seems like, what are there resources to help me? Is this normal? I personally asked my parents about this, and they had children much younger. So by the time they were ready to take care of their parents, their children, they didn't have to do all the nitty gritty stuff. They didn't have to do all these play dates. They were mostly probably in high school or even in college, where the kids were more self-sufficient. But now it almost seems that I'm helping out my child or my children, I'm helping my parents, and then what about me? I'm kind of stuck in the middle because I feel like I'm being pulled in so many different directions. So yes, that study is actually accurate, and I think brings on um, a lot of things for us to think about as to how to juggle both. I would say, as a medical doctor, what are some things that you're seeing where you find maybe the families in their 30s and the 40s are having a difficult time taking care of their parents, and while at the same time taking care of their kids?
I think what I'm mainly seeing is the emotional strain that comes
Mm,
with it, and then the financial strain, and knowing what resources are out there, or if they can even afford the resources that are
right.
available. Depending on culture, Nigerian culture, we're more community oriented, so it's not as difficult compared to American culture. You guys can chime in if you see a difference, but
Right.
with a community, type of culture, it's not really something that you think about. There's always somebody that you can call to come and help
Yes.
stay with your kids. If you have to go, take your mom or dad to the appointment, there's always somebody that can help cook for you if you need that, or
Yeah.
if you need somebody to stay with your kids and you guys can go on a vacation. So it just really depends on what resources are out there and utilizing them. Some people are a bit prideful. They don't want to
Yeah.
ask for help. And that's another barrier to get over, is to ask for help, because you're going to need some type of support. You can't do this on your own, especially, with your mental health, your emotional
Yeah.
well-being. It's important to ask for help and then do what is right for your family. You don't have to
Yeah.
do what other people have to do. People feel, oh, it's just natural, let me just have my parent come and stay with us, problem solved. That may not be best for your marriage, that may not be
Right.
best for your family. It may be better for them to maybe go to an assisted living or
Yes.
do 24-hour nursing care. It's all, individualized and dependent on what's best for you, what's going to keep you sane and be able to do this in the long term. So those are things to think about. And I
Right.
want to really stress upon preparation, making a
Mm,
plan, deciding,
yeah.
between you and your spouse or your family, what works best for you, and to know what you have financially to do
Right.
these resources.
Oh, that's a good point. Those are many, many great points. And I think resources is a big thing. I remember when I was going to put my daughter in daycare. So I was thinking, like, am I a bad mom for wanting to put her in daycare? And then going through things with my patients, starting thinking about nursing homes, right? Like, I'm thinking one way or the other. And, in our culture, is that taboo to even discuss putting your parents in a
I think
assisted
it's
living or putting them
Yeah,
in a
it's
nursing
taboo
home?
for everybody because it has such negative connotations to
Yes.
it. You hear all these horror stories about neglect. They're not taking care of my mom or dad.
Yes.
They haven't been moved from their bed. They're not administering their medications like they should,
Right.
and all of that. So that's a huge thing to get over, is
It
that
is.
type of stigma when it comes to nursing homes and assisted living centers. And
Right.
what I say is to do your research. Go visit the
Hmm.
place, look at the place, look at who's working there, look at the administration, look how they handle their medications. Do they have any type
Hmm.
of activities where the patients can go and do different things? Do they have where they can travel, do field trips? Look at the medical
Yeah.
director, see how he manages the patients who need to do medications. So, in that regard, you need to do your research, make sure that you're taking them to a place where they're paying special attention and that they're not
Right.
neglected.
Right. Someone said 24 hours nurse living for Nigeria. For
Yeah,
Nigeria parents care. It's true, but you know what? They also have those day adult programs.
right,
They have those. It's growing up here, it's different. That community is different. In Nigeria, the whole street, everyone comes out, everyone talks to each other, everyone knows everyone's business. Here it's like, do I even know my neighbor? I don't even know my neighbor.
right,
I don't really speak to my neighbor. So it's almost like, yes, the 24 hours may be a little much now, but what about programs where they're not just home by themselves? That
right,
also leads to depression. That also leads to so many different things. Poor eating habits. They're not up and moving, right? They're not
right,
being as active as they should. So that also moves into comorbidities for them that they could avoid if they were not just sitting at home.
right. And that's
So it's
something, yeah, to think about is like, okay, you bring your parent here to your house. Are they going to
mhm,
stay in the house the whole day, not to
right,
do anything? You're just going to leave them there by themselves. You're not going to take them out to a day center. I mean, or who's going to feed them? Or is there, or
right.
can they cook from themselves? And then, when it comes into medical conditions, cognitive impairment,
Mm-hmm.
dementia, they by themselves. They can't be alone. And then you're like, I can't, stay at home. I have to work. I have kids I have to feed too. I can't stay at home. Who's going to be with my loved one in the home? How much is that going to cost? So
Right,
those are things that you have to consider. You need to know your own financial strengths and, things that need to be worked on and see what limits you can do in terms of resources. Some people can't afford to, put their mom or dad in
mm-hmm.
an assisted living center or a nursing home or take them to respite care if they want to go on a vacation. Some people can't afford caregivers. So what do you
Yeah.
do? And that's the issue, is how do we cope with something like that? There's some people, I always say patients because that's how I mainly deal with is my
Right.
patients. Some, they have to retire early.
Yeah.
They can no longer work. They have to
Yeah.
leave their work early and retire early to take care of their loved one. And that happens a lot because they don't have any other choice. And then there
Right.
comes the financial strain because their income has changed drastically. And then
Drastically.
they have to figure out, okay, how do I accommodate my parent? Do I have to make everything accessible? Do I have to now
Right.
change the tub to now a walk-in shower? All these
Yes.
things now come into
Modifications.
mind. So
Right.
those are things that you kind of have to think about when you want to consider, bringing your parent into the home, and then
Right.
making sure that everybody's okay with that.
Agreed, agreed. So I want to hear from you all. Who all are or who else taking care of their parents while having young kids in the home? Drop it in the chat. If you just put your hands up, finger up, if you are taking care, if you're almost like a caregiver, you don't think you are yet because you're a child, right? You're taking care of your parents, but you also have young children at home that you're taking care of. I want to hear from you in the audience, in the comments. I want to hear what are some challenges that you all have. Do you go with your loved ones to their doctor's appointments? Do you understand everything that comes with their doctor's appointments? Do you feel that you can juggle taking care of your parents while taking care of your loved ones or your young ones at the same time? And if you're not, and if it's just you, say, hey, it's just me and I'm okay with it. But drop it in the comments. Let us kind of see, let's gauge who's in here. I know a couple of you that have gone through taking care of your parents or your in-laws while taking care of young children? What were some difficulties that you had? What are some things that you wish you knew about that no one told you? What were some challenges that you had? And what are some good things? Because sometimes I feel there's always positive in some things. So what are some positives that you kind of you learned about while taking care of your older parents, while taking care of your younger ones also? Drop it in the comments. I want to hear. This is interactive. So I do want to hear from the audience. I want to hear questions, comments, stories that you all have that you would love to share. So while we're waiting on that, Dr. A, what are some things I want to talk a little bit about burnout. I want to touch on that because this we're going to touch on quite a bit. I want to touch about that burnout in taking care of your parents and while taking care also of your loved ones. Have you seen that in the clinic? Do you physically see the children being burnt out, or do you hear about it?
Oh, yes. I have a number of stories. I have, we say kids, but they're really in their 40s and their
Right.
50s. They're crying. They're bawling out to me. I can't take care of my dad, my mom anymore.
Yeah.
I've had it. I'm at my wit's end. I can't take it anymore. Put her in a nursing home now, right now,
Hmm.
today. It's been that
Wow.
drastic before. They're crying to me. They're like, I can't do this anymore. Like they'll mention, oh, they wandered off,
Yeah.
and they had to look and find where they were, things like that. Or a lot of things that happen, especially with dementia patients who have cognitive impairment, is they get agitated, they get angry, they get
Mm.
short with people with
Yes.
them, and that becomes frustrating. They're no longer, the conversation has changed. They're quick, they
Right.
have a short fuse, and so that gets mentally tasking. They just get sad because their parent is changing in front of their eyes. They can't just, they're used to, them being, that's my parent, that's my dad, that's my protector, and the
Right.
roles have changed. And so coming
Right.
to grasp with that is a huge, mental thing that they have to go through. So that's mainly the main thing, is like, how do I take care? And it's usually, patients, or, well, my patients who are, have cognitive impairment,
Right.
dementia, where they can no longer take care of themselves. That's where I really see the
Mm.
burnt out, is where they're having to leave work early. They're
Right.
having to come home and feed them,
Right.
bathe them, find accessible things, shower chairs,
Mm-hmm.
bedside commodes. They're
Correct.
having to manage their medications. They're
Yep.
having to learn all their medical conditions. That's where I really see the burnout, is where the parents or the elderly is at a point where they can no longer take care of themselves. I think now in the 30s and 40s, we have parents who are still able to do things. They're
Yeah.
still able to drive. They're still able to cook and clean for themselves. We're able to watch our babies. Right
Right.
now it's great, but there's going to
Right.
come a time
Where they
where
can't
you're
do
going to
that.
notice they cannot do that anymore.
Right.
So how are you going to deal with that?
True, true.
How
Someone
do
put
you
in the jit. Someone put in the comments.
okay.
Mine is a mix. Parents are still able to help with kids, but we have to start thinking of colonoscopies, cataract surgeries, and other things coming up. I remember when I first took my dad to get his colonoscopy, and it was like, huh? I mean, grateful he was able to fill out his stuff, but even afterwards, I felt like I had to take care of him a little bit, and so I see it with my patients. I teach my patients home modifications. I preach education, caregiver training. I do all of that, but it's different when it's my parent whom I know has been independent, taking care of us, haven't had any issues, right? Now I'm thinking like, oh, do I now have to start thinking about these things? So absolutely. Someone wrote, my 85-year-old mother-in-law stays with me. She's quite agile and can do stuff by herself. Awesome.
That's
That
great.
is that is a plus. That
Yeah,
is huge. Whatever she is doing, please share with us, because I think some of our parents, as they get older, stop doing things. And so maybe that plays a role in them, their medical condition. So 85, and she can do stuff by herself. That's amazing. That's
Right.
less burden on you and allows you to focus on home. Someone wrote me too. However, a big variable is having siblings that are on the same page with you and equally equally have resources to share the burden with. Yes. And I think everyone, I believe when we have children, more than one child, it's now everyone's responsibility. You see it more where it's one sibling or one child who is taking on
Hmm.
this burden, and
That happens a
everyone
lot.
else, I hate to say gets to just live their life, but do get to live their lives. So this is where we call a family meeting. This is where we rotate. I have
Mm.
plenty stories from patients where it's the same child bringing their loved one to therapy, and they're tired, and they have other people that live in the same city as them, but they're like,
Hmm.
oh, she's not that type, I don't want to bring it up, but it's a conversation that needs to happen. Someone said, for us, my in-laws didn't want to bother us, so even if they weren't feeling good, they wouldn't say anything and keep praying and manage it silently until it got worse. So
That's a
yes,
common
they
thing
don't
that
want
we
to.
see.
Sorry.
Yeah, sorry. That's a common thing that we see with
Yes.
my patients is that they don't want to be a burden. They don't
Yes.
want to tell their child what is going on. They still see
Yeah.
them as a child.
Yeah.
So they just don't want to become a burden. They know they have kids to take care of. They feel they can manage on their own until they can't anymore. So that's
Right.
that's something that they have to come to grasp is when do I start asking for help, or when do I know that, okay, I actually need help from my child. So that's something that from the patient or the elderly aspect, that's something that they have to deal with, is learning to know that you're not a burden. I have had
Right.
conversation with patients. They don't view you as a burden. They want to
Right.
take care of you. They want to
Right.
be with you. They want to make
Right.
sure that you're doing well, that your
Right.
quality of life is great, you're eating, you're drinking fine. If you, they want you to be with the grandkids more. They don't view you as a burden, so don't take it that way.
Right. Dr. A, let me ask this question. As a medical professional, because, at home with Jimmy just brought up a good point. If they don't want to say anything, you as a medical professional, if you see obviously that they're not following, or maybe their blood work is not where it should be, how do you typically handle that? How do you help them, or do you help them ask for help? Let me ask that. Or how do you kind of deal with that in a session? You see that stuff is going on. You see, based on their blood work and physical examination, they're just not where they should be for their age and gender. But you see they're kind of mute in your session or in their appointments. What do you do as a medical professional to kind of pull that out of them, if you do?
So I do. So that's one thing that about the medical field, especially nowadays, you need to know everything about the patient,
Yeah.
not just their medical conditions, what medications they take or specialists they see. You need to know what's going on in their home. Who's
Yeah.
with them? Are they living with somebody? Who's taking care of them? And that's usually the introduction in terms of asking the patient, like, is there somebody that can help you? Is who do you live with? Do you live
Right.
alone? Do you have any family near you? Do you have a support system? Who takes care of you if you need to go somewhere since you can't drive? So that's usually how I start the conversation
Good.
as to basically their current living situation, and then socially, what do they do? Who do they, how do they interact? What do they like to do? That type of thing. Because you really need to know everything about them. It's not really going to help you give them medications, but
Yeah.
there's nobody that's feeding them at home, or they
Right.
don't have running water, or there may be
Mm.
signs of elderly blues. Somebody's not taking care of them. They have
Right.
bed
Right.
bugs and all this type of stuff. You have to really know every aspect of their life to really get an idea of, their comorbidities and
Right.
basically their quality of life. So, because that's essential in them progressing.
That's awesome. Yes, that definitely goes a long way. I'm gonna say Josie because I know him as Josie Jose Akeze. said, I have three siblings and we're all equally involved with helping my parents out. It's nice to know the responsibilities don't fall on just one person. That is huge. I can't stress that enough. That is huge that you all are able to really come together as one. In my profession as a physical therapist, I don't see it as often as I probably should. I really don't, and I think it's something that, if you're not having conversations with your siblings, start having those conversations. Is how we're gonna do this. I know people where it's the boy, the son, that is taking care, whereas per culture, it's the woman or the
Mm-hmm.
daughter that takes care, right? I'm seeing it more like, no, I live with my son and his wife and they take care of me. Whereas my daughter is doing, off doing whatever she wants to do. So if you're not having those conversations with your loved ones, please do start having it so that there's no resentment that's built, because no matter what, we're human. And if we're the ones doing everything, it comes off little by little, like little jokes. And then it's like, well, I'm the one that's doing this, I'm the one that's doing that.
Mm-hmm.
Later on in our series, we're going to talk about power medical of
I was gonna
attorney.
say,
We're going to talk about finances. We're going to talk about resources. There's so much more that we can talk about. One of it is going to be about provider services. If you can afford for someone to come and help take care of them, in some states, in the state that you live in, what does that look like? Could you get paid? Could you be put on their insurance? Things like that, so that at least there's something coming back to you. We're going to talk about being a burden, or feeling like, they're a burden, and being able to vent. Like, I'm really irritated with my mom right now because X, Y, and Z. Being able to know that that's okay and that's healthy. I think the biggest thing I'm also learning is being able to share and be honest with our parents, finding out, what it is their wishes are,
right.
finding out what they're comfortable doing, and being honest and be like, okay, mom, I want you to start taking care of yourself. Can you do this? Can you help me with this? And you're not a burden. Do we feel comfortable sharing that information with our parents, or do we feel like we're the kid? We're not supposed to talk about it,
Yeah.
you know?
Right. Yeah, you need to start getting comfortable. I know it's an uncomfortable situation, but you have to start entering that role as to what are your wishes going to be? What do you
Right,
want? And then not
right,
only knowing it, but getting them to put it in a living will, getting an
right,
advance directive, having that set in stone. That way there's no uncertainties,
right.
there's no potential for bickering between the siblings. I've seen that where I've almost been deposed because
Mhm.
there was my patient, her wishes not being granted, and they're trying to put me in the middle of it. And
Right,
so you want to get all that stuff planned out, written down ahead of time before the patient or the elderly who you're taking care of becomes incapacitated. So
right.
that's very important for, the siblings, the family to be on the same page, because when they're not, bad things can happen. And that's really where the elderly patients can come into play, because they
Right.
know, okay, I had a patient the other day, like, I know my daughter is not going to let me go. I know that for a fact. So I need to
Mm.
put this advanced directive in place
Wow.
because I know she wouldn't be able to handle it. So
Wow.
you're easing that burden off the child in terms of making decisions when you have all those things in place. So they'll
Right.
have peace of mind knowing, okay, this is what my mom wanted to do, so I'm going to respect her wishes.
Right.
So, like I said, planning, preparation is key. It will make things later on, much, much easier, much more better to cope with in the long run.
Yeah, I mean, that goes a long way. Prince Cato, my mom who stays with us, grandkids love her to death, is very independent, but thinking about her aging into the seventh decade feels like, whoa, where's time fly? It's scary, y'all. It is scary. Culture plays a huge role in how open and transparent we are with our parents. It does. It does, but I feel
Mhm.
like we have to break that barrier, because
Right.
even now, some of the jokes that I even make with my parents, I'm like, ooh, Am I gonna get slapped? But they kind of let me in because
Ah,
they know that I'm an adult. I
right,
say things like I'm somebody's wife and I'm somebody's mother, so you can't give me a
right.
backhand.
I do that all
But
the
it
time with
is,
that. Yeah.
we're scared. Our culture is teaching us that. Talking about life insurance with Nigerian parents is another thing. It is huge, but we have to do it. We have to talk about it. My
Right.
grandfather, my mom's dad, he
We can't hear.
at his funeral. He planned his caterer. He planned which hall they should use. He put, like, he literally was very specific. And to be honest, when time came, there wasn't any fight about, oh, daddy, we want this. It was simple. He wanted a lot of people. He wanted a big hall. He wanted a caterer. He made provisions. He just made sure that there wasn't any fighting within the kids when it came to that part. So I really admired that. And I try to have that conversations with my parents. One of my parents, I'm not going to say who because one is on this live. One of my parents is all about wills and all about life insurance, all about that. Another one of my parents like, that's, we're talking about death over there. We're
Yeah,
not,
it's hard. I
you
mean,
know,
even with just, with
are you
me and
planning
my
for your
husband, and we did our own, living will and everything like that, estate planning. You can ask him. I started crying when he was asking, do you want to be
yeah,
cremated or do you want to be buried? These are tough
yeah,
conversations. And
yeah,
then to have it with the loved one, it's even harder, but it's really important. It's
yeah.
really, really important. And also, knowing about their finances. I asked dad the other day, I'm like, does any of us children have access to your accounts? And
Mm,
he's like, well, I've been thinking about that and I need to look into it. And
yeah.
he's like, but just know that the access is to put money in, not put money out. So I'm like, oh my God. So I think the conversation, they're willing to have that conversation because they realize that, I'm going to need help someday. I'm going to need
Yeah.
somebody to take care of me. So it's just
Yes.
one step at a time. I know it's hard, especially with the culture, but it's just one step at a time. Just, introducing that conversation during family dinner, Sunday time, just to kind of get everybody on the same page or thinking
Right.
about what their wishes want, what the wishes of your loved one wants.
No, it's true. It is one step at a time, and that's why I wanted to do these series about the sandwich generation because I have a young one, and my parents are getting older, and I'm, some days I feel like I'm pulling between both. And we're gonna talk about self care. We're gonna talk about your mental health. What that looks like. So I wanted to open up this conversation about the sandwich generation, not necessarily for our culture, but for our age group, because it's not, I think we're scared to start it with our parents, but we're thinking it. We're seeing things, we're hearing things, we're thinking about it. So I really, really appreciate us even venturing into this and starting this conversation. Oh, I see some comments. Let me see. They will ask, "Are you planning for their death?" I know, it's so bad. I know they will ask if we're planning for their death. It is ridiculous. It's crazy. Hospice gets involved with end of life planning before death. FYI, we're definitely going to talk about hospice because hospice. Oh my goodness, there's so many taboos, so many like negative connotations that I hear about hospice. But I have a couple of patients in there and they're telling me so many things, and it's blowing my mind. I'm like, oh, I thought hospice means,
Right.
God forgive me, you pass away tomorrow.
Right.
And
There's a
they're
lot of
like,
misconceptions.
absolutely not.
A lot of
So,
misconceptions about hospice care and
yes,
palliative care. They hear hospice and they get scared, like, oh
yeah,
no, I'm going to die tomorrow type of thing. So there's a
right.
lot of services that go with hospice. I mean, I was even surprised, even with, my
Mhm.
mom, when we had put her on hospice care, they had a lot more services than just home health and
Right.
people just coming in and managing their medication. So that's a good topic to have in the future.
We're definitely going to touch on that. Funny, Adi and his family are still trying to access their dad's bank account. It's been a year and not easy process after death. It is, y'all, that I mean, I'm hearing stories that is is crazy. It's almost like your loved one or your parents worked so hard and they saved and they did investments only for it to just go where, so I'm so glad that we're talking about this. I'm glad that we are touching base about it because I think it's really going to educate us. Can we educate our parents? I don't know. Do I want to sit here and truly educate my parents? I want to try, but I want us to be better. I want us to do better for our young ones coming up. Prince Kato, isn't it odd that the only thing we are guaranteed in life is death? Yes, it is. Someone said, I only have to do two things in life. They said, pay my taxes and die. I was like, oh, that's that's real. That's real. Juliana Talabi said, African parent in hospice, it'll be more, I know, for that child in prayer. I know. It is, but I'm hoping that we get educated
Yeah, it's
and,
going to take a lot of
we
education.
Yes, we educate ourselves, we see, and we educate them as to, what it entails and things like that. So, I am super, super glad that we started this series. If you all like this series, Sandwich Generation, please put thumbs up in the comments. If you don't like it and you want me to change it, you can put a thumbs down. But I really do think this topic is really important to us all. I think as we're getting older, our parents are getting older, we can just we can try to navigate this together. We don't have to navigate it alone. I think that's one thing I like about our generation is that we share. We talk about things. We talk about our feelings. We're able to ask questions. So I'm glad that you all love this topic. It's super brand new to me, but I'm gonna try to share as many personal as I can. And I love, Dr. A. She's also sharing personal because we have to be real. I don't want it to just be, what it should be, but things that we're actually going through in life with our parents, with our loved ones. We need to bring a parent and see how they're open to. Yes, that is on the list. Juliana Talabi, that is on the list. I'm not only gonna have our guest speakers are also gonna include people that I know or people that have been reaching out to me that want to share their experiences. I think everything doesn't have to be medical. I think everything doesn't have to be formal. I think being able to connect on a human level, I think is huge. I will have to probably do this live with our parents or someone. It's going to take a lot of work from me because they're trying to navigate Instagram and all of that. But yes, that is on our list. Next week, we're talking a little bit about men's health and the sandwich generation. So that we're going to bring in real life experiences. If you have any loved ones that would love to share their experiences and want to come on as a guest, please, please, please share. I am more than happy to figure out logistics to get them to hear from them because we can speculate all day, but actually hearing from our loved ones in the older generation, I think will be a huge plus. Let me see. We talked about that. Ours is 15 years and nothing. So we have given up on accessing daddy's account. 15 years that you couldn't get that money. That's y'all. I am working way too hard for my children and my grandchildren not to spend that money. Everyone has to, that
Yeah.
money has got to go. That can help with college. That can help with
Mm-hmm.
even taking
Mm-hmm.
care of them. When they get to the
Right.
point where they're not able to make decisions, being able to get into their account and use their money for their health is important. I'm going to ask my dad for his bank account today. He's going to tell me no, but
It's
I'm
good. My
going to
dad,
ask.
he at least gave me all his accounts where they are. He has one in
Okay.
Nigeria as well, so that's a good step, you know.
Yes.
But yeah, it's something that we've been talking about. So definitely, you want to touch on that stuff now while they're of
Yes.
sound mind before,
Yes.
it's too late.
That's true. That's true. Any final comments, any final questions?
Questions?
What would
Any
you guys
questions?
like to
Yeah.
see? Sorry, Dr. A, what did you say?
Yeah, if anybody had any questions, yeah,
Yes.
questions for me from a medical perspective or resources or, things to talk to their doctor about um, in terms of taking care of them.
You're on all your mom's accounts by force. Oh, Lord, grant me the same thing for my parents' accounts. It's all about educating their parents. It is. It is. And how you do it, right? They get very defensive, and being how to, it's not what you say, it's how you say it. We should touch on how to find affordable insurance for them. Yes. Yes.
Mhm.
For those that are,
Depends on citizenship
yes.
is a factor. Do they have social security? Do they have a social
Yes.
security number? How old are they? Do they
Yeah.
qualify for Medicare? How's the state insurance look like? What's the eligibility? So those are things that you have to really figure out, what do they qualify for? If they're not a citizen, it may be a uphill battle. You
Right.
may need to you go private with private insurance or something like that. So those are things that you can look into, figure out what they qualify depending on, citizenships.
Right. We do have a social worker that's also going to touch in and share some resources that they may have for us. Resource websites you can recommend. I always say go to your state's website. Every state is different. What, for example, in California, quote me, don't quote me. California, I believe your loved one, your parents can actually get on your insurance. In Texas, you can become a provider. Like there's so many different tricks and tips, I guess. But I would encourage everyone, look up your state, look up your insurance, call your insurance. We're gonna have a whole session about insurance. I think I am going to talk about that. Look up your insurance, ask your insurance these questions. Can I put my mom on my insurance? Can I put what does that look like? Definitely, we'll try to get some resources. I'll try to share them on this page until we get our other page going. I will try to share them. And Dr. A, if she has any resources, she'll send them to me and I'll put them on our page also.
Yeah,
Folks be
click on
missing
the geriatric physician recommendations. So I just have a quick thing. It's called the 4 M's when taking care of an elderly patient. What matters,
Mm.
medications, mentation, and then mobility.
Mm.
First, what matters to your mom or your dad? What's the most important thing to them? Family, no physical restrictions, financial peace, no financial burden, figuring that out and then trying to go towards that goal. Do they have the resources to fulfill any of those goals? What are their wishes? Do they have an advance directive? Things like that in terms of what really matters to them. Because if nothing matters to them, if their
Yeah.
mentation is down, they're depressed,
Yeah.
that feeds into, their physical well-being. If they're depressed, they're not going to want to eat, they're not going to want to drink. So really knowing the root as to what they're continuing to live for. And then medications, self-explanatory. How many
Right.
medications are they taking? Are there any high-risk medications? We have a list called the Beers criteria.
Yes.
Medications that are not recommended for, geriatric population, which is usually 65 and above. Benadryl is a big thing. People just pop Benadryl, want to go to sleep. It's actually not good for you. Can cause
Right.
long-term cognitive impairment. So learning about things like that. And then I've touched on mentation. What's their cognitive ability? Are they still able to read and write? Can
Mm.
they remember things that you mentioned to them, 3 minutes later? What's their short-term, long-term memory? Things like that. Mobility. Are they a fall risk?
Yes.
Are they easily falling? Do they need a walker? Do they need a cane? Do they need a shower chair? Do they need to have a walk-in shower built in? Things like that. Falls can really change their quality of life and it can increase their
Yes.
risk of mortality. So it's very important to know about how they move their mobility and if they need any of those assistive devices. So 4 M's.
Absolutely. Oh, thank you so much. I'm gonna have to put that on a post, because I think that's super, super important for us to just think about. So thank you so much for that. At Home with Jumi, if people can talk more about transportation, appointments, most people don't know some insurances provide transportation. Yes, I know. I can speak for Texas Children's. Even though you're an adult, you can have Texas Children's. They provide unlimited transportation to medical appointments. Your traditional Medicaid may offer limited, but things like that. Their organization, we're going to speak with HAPS, Houston Area Parkinson's Society, is going to be one of our guest speakers. They're going to speak about how organizations around also do provide transportation to medical appointments and things like that. So transportation is huge. What does transportation look like? Does your loved one have to be with you? We're going to touch on all of that, because is it easier for me to just kind of send my parent on? Maybe all they need is transportation. Maybe they're able to understand the doctor, share, do all of that. Or do I have to be with them? Are they in a wheelchair? Is there a wheelchair accessible? Things like that. So definitely we're going to touch on transportation. I'm getting more resources each day. People are reaching out to me and sharing so many things. So I'm super excited to share those things with you all. Do bear with me as I am trying to organize it all, so I don't just overwhelm us with just medical information. But yes, the 4 M's, I'm even going to take something away from that. So thank you so much, Dr. A, for that. Any other last comments, any information, any resources that you all have? I don't know it all. Dr. A doesn't know it all. You all may also have some tips and tricks up your sleeve that you've learned throughout the years. Please feel free to share. You don't know who can benefit from it. You don't know who is in the same situation as you. I don't want to do life alone. I want to do life with you all. I want to have as much resources, know as much as I can to better take care of myself, my children, and my parents, and the people in my life that are in the older generation. So I thank you all for joining my first guest speaker live. Thank you, Dr. A. Can we please
You're
get some
welcome.
claps
It's my
in the comments?
pleasure. Thanks
Please,
for
please,
having
please.
me. I
Thank
appreciate
you.
it.
Yes, this was awesome. This was super awesome. If you enjoyed the conversation, please put thumbs up, put some claps in the comments, all of that. Let us know that this was good and you guys needed it and you guys learned something from it. I truly, truly appreciate you taking some time out of your evening to just hear us out, and hopefully you all got some information from us. So thank you all so, so much. I try to keep to time. I'm doing well with time. So I'm trying, but Dr. A has been amazing. As soon as I thought about it, she jumped on board and said, whatever you need. And I thank you for that. I thank you all for just joining. This has been an amazing conversation. I'm super excited to have many more. I hope you all join every Monday at 8:30 Central Time. Please, please, please join. I'm excited on the more speakers that are coming on. Dr. A, you've really set a precedent, so I'm super, super
I try.
excited. We do have a
Yeah.
dentist coming on board. We have a dentist coming. We have an optometrist coming. I'm pulling everybody. If everyone that I know is coming on board. So I'm surrounded by great, amazing people who are just a wealth of knowledge. And I just want to share my network with you all. Link between good oral health and overall health. Yes. There have been some diagnoses through oral health. So I have heard of that, and through the eyes also. So I'm definitely OBGYN, yes. OBGYN is coming on board. We are going to finish this month out with men. We're going to have a male speaker next week. It's men's month. Men's health. I think we should definitely have a male speaker talk about just men's health. Hi, Bookie. I think having a male speaker would be great. So next week we're hope to have a man to wrap up men's health, men's month, and then we'll kind of go from there. Thank you all so much. Thank you, thank you, thank you, thank you. This has been amazing. We can talk about diabetes and how I got off medication. Yes, 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 yes,
Great.
yes. How many of our parents are diabetics? Where does that put me? I remember when I was pregnant, I had to check my sugar. So in my mind, I'm like, oh my gosh, my future. My husband tells me all the time, don't drink that Coke. Don't eat that brownie. So diabetes is definitely a good one.
Mhm.
They don't have enough safe spaces to talk about, to have their talks. Yes. We are definitely going to speak about diabetes. Interested in diabetes and getting off meds, please. Yes, that is huge. Even
Yeah, it can be
hypertension,
done. It
getting
can be
off
done.
that. Let me speak. Brush checks. Were you also on hyper? Wait, did you also have hypertension, or was it only diabetes? We have to take a deep dive into hair loss and hairstyle practices when I get on. Oh, yes,
Mm-mm. Yeah, that's
yes,
some
Doctor.
hard
Oh,
talk.
yes, yes. So we're gonna talk. Hair loss is big, and hairstyle. Yes, yes, yes. You know you're on the schedule. I'm loving it. I just please whatever resources you have, whatever you're dealing with, please, and you're comfortable sharing. Do reach out to me. Let's get you on the schedule so that we can talk and we can educate. This is awesome. You guys are amazing. Thank you so much. This is a great job. Very informative. I'm so glad you guys. Yes, thank you. That is BGG. Absolutely. That is big. I've been off BP meds too since 2018. That is huge. Yes, this should be recorded, y'all. Pray for me. Pray for me with this technology. Pray for me. Our first live wasn't recorded and I was just almost in tears. So, yes, I believe this is recorded at home with Jumi was she's my IT, and my big brother Tayo is also my IT. So yes, you've been on blood pressure meds. We'll talk about all of that. Being healthy, staying healthy. Having kids older, so we have to live longer for our children. So thank you all so much for joining. I truly appreciate it. I will see you all next Monday at 8:30 right here on live. We're going to be right here on Your Girl Tomi's page. Once I sort out the other page, we'll move there. But as of right now, I will see you next Monday, the 30th, 8:30 p.m. Central Time. Make sure you save it. I know I'm gonna try to save it. No pressure. No pressure. Thank you all so much. Love and peace. Have a blessed week. I appreciate you all. See you next Monday. Put it on your calendar. See you next Monday. Have a good one. Bye. Thank you, Dr. A. Thank you
Thank
so
you. Thanks
much.
for having me. You're welcome.
You're
Take care, guys. It
welcome.
was great to be
Bye.
here.
Have a good one, everyone. Thank you. See you next week. Bye. I'm going to wait till everybody says bye. I don't want to hang up on anyone. Bye. Thank you. Thank you. Thank you. Thank you for
Thank
joining. Thank
you.
you so much. Yay, my big brother Lamide joined. Wow. Thank you so much. We got so much support. Thank you guys so Dr. A, you brought out all these people.
Nah.
Thank you. Bye. Okay, what did you say? By the way, what did you say Ticey won? She said BT that. Thank you, Dr. A. That's rock rehabilitation. Bye. Bye, mommy. Y'all look cute. Black excellence. Yes, 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 yes.
Yay.
You're coming on too, Dr. O. Bye, y'all.